Hello friends, I am Shiriti Vishwas. I completed my physiotherapy in 2005 from Rajiv Gandhi University of Health Science, Bangalore. Since 16 years, I run Pulsation Physiotherapy and Rehabilitation Center in Barakpur, Kolkata. Friends, my today's topic is cervical radiculopathy and its pain relief exercises. Let's start with the definition. A pinch or irritated nerve in the neck causing the pain, numbness and weakness of the muscles radiating to the chest or the arm. Causes cervical radiculopathy often caused by the wear and tear changes occurs in the spine as we age, called arthritis, like degenerative arthritis. And number 2 is in younger people it can often caused by the sudden injury that can be result in a herniated disc. Number 3, the narrowing of disc spaces where the nerve roots exits the spine, which can be a result of bony spurs and stenosis. Symptoms: pains in the necks and arms, shoulder and back and throughout the forearm, fingers, tingling sensation, pins and needle-like sensation, and numbness of the finger, it may be there. The type of pain can be dull aching to sharp burning type, and reduced sensation of touch and tingling sensation towards the back and towards the arm, forearm and the finger, with the finger numbness can be there. Most common nerve root is the C7, which get impinged in the C6 and C7 vertebra. But here you will not get any pain because nerve roots doesn't have any receptors. You will feel the pain in the muscles innervated by that pinched nerve in the arm, forearm and downwards. Like C5 is supplied the upper part of the arm and the deltoid muscle and the bicep muscle. C6 is responsible for the sensation of the upper part of the forearm, the thumb and the index finger, and it causes the movement like extension of the wrist. Let's come to C7 is responsible for the sensation of the middle finger and the triceps muscle, and it causes the movement of the wrist flexion and finger extension. And the people who is getting difficulty in bench dips or in push-ups, they maybe feel pain in the triceps muscle. C8 is responsible for the sensation of the little finger and the lower part of the forearm, and T1 is supplies the intrinsic muscles of the hand. So if T1 get impinged, the weakness of the intrinsic muscles can occur. Sometimes in my chamber I saw in some patient used to come like this. This is called the shoulder abduction sign. If the shoulder abduction, this movement causes the centralization of pain, and if they hang the arm like this, it will started pulling the nerve roots from here, and the pain peripheralization occurs, means pain started going downwards to the arm, forearm and the fingers, and the position is deteriorating. If patient is feeling better doing arm like this overhead, then surely it is due to nerve root impingement. If the person is doing computer job, then he has to sit on a proper armrest chair, or he or she can use a pillow on the lap and they can put their hand on the pillow. Or if the person is doing some repetitive movement or work, then he has to take some rest like 15 minutes in between the work to decrease the tension in the nerve root. I personally don't like to use some cervical collar, or don't recommend patient cervical collar, because the person wearing cervical collar thinks that this is a good solution, there is no pain, but after long term of uses of cervical collar, there is no movement of cervical spine, so there is no movement of cervical synovial fluid, no production of synovial fluid inside the cervical spine joints, and the muscles get weakened and the stiffness of the joints occurs, and very difficult to return to the normal life by rehabilitation after using long term of collar. Before I will start showing, I will suggest first you get right diagnosis from your doctor, and just you check once all the exercises from your doctors, because some of the exercises are contraindicated for some of the condition. Let's start the exercises. Like first I'll show the isometrics. Isometrics is the exercises you can do without moving the muscles, and you have to strengthen the muscle just by putting resistance. Like first movement you have to do like this, but just put one hand or two hand, whichever you are comfortable. Just give your 70% of pressure, and by this hand give resistance, and by your head you just want to do your flexion movement, but as a result your head will be neutral and you will feel the stiffness in the back of the head. Hold for 10 seconds. 6, 7, 8, 9, 10, and release. You can do it 10 times and twice daily, all the exercises. Then this side, just side bender muscle. You have to do this movement, but just put resistance here. As a result, the head will be neutral position. Keep doing for 10 seconds. Release. Here you will keep doing for 10 repetitions, then do it for other side, and then you can do it for your back side, like the back of neck. You put your hand and you have to do the extension movement, but by your hand you have to resist the movement. As a result, the head will be neutral. Just 10 seconds resist your movement. 5, 6, 7, 8, 9, 10, and release. 10 repetition twice daily. So my next exercise is chin tuck. Just sit straight and sitting on a sturdy chair. Be comfortable. Just put one finger on the chin and tuck your chin inside and hold for 5 seconds. Again. Again. My next exercise is extension of neck with the help of towel roll. Just you put a towel roll at the base of C6, C7, base of cervical spine, lower base. Then just put a little pressure on the towel roll, and you have to do the extension of your head. Just you will think your head is hanging on a towel. It's a slow movement. Again I am showing. You can do it 10 to 15 times. And then my last exercise is butterfly movement. Just stand in front of one wall and just butterfly movement. It causes release the tension on the nerve roots and centralizes the pain. Then again just touch your back and head on the wall. Stand comfortably and start doing this movement 10 to 15 times twice daily. So friends, if you are getting any value and information from my channel, please subscribe my channel.